physician assistant at Allegheny General Hospital, and I'm involved in Jake Staup's senior project in shadowing hospital staff, including physicians, physician assistants, and the other supporting staff. Specifically, as my duties as a physician assistant involve coming in, and we have various rotations where we round either in the surgical intensive care unit and prepare information for the surgeons as they come in, so that we can report on each individual patient and come up with a plan. If we're rounding on the floor, we do the same to keep patients moving towards home and coming up with a discharge plan and adjusting medications as necessary, and optimizing everything in their patient post-operative care. That also includes removing drains, evaluating incisions, doing physical exams. We also admit patients and order diagnostic testing, start the process of figuring out what they need for the hospitalization in order to, again, progress them through whatever direction they need, whether it be just optimizing them or channeling them towards surgery. We also assist in the operating room, and assisting in the operating room entails everything from setting the patient up for the surgery, positioning, assisting with line placement, getting information such as chest x-rays ready, CT scans, any studies that we're going to need for the procedure, important information that's relevant to the procedure. We assist in specifically harvesting vein for bypass procedures, for coronary artery bypass, and then assist the surgeon in sewing the grafts to the heart and any other tasks that need to be performed during the actual procedure. We are responsible for closing the patient with the surgeon and getting them back up to the intensive care unit and making sure that everything goes well in getting them transported from the operating room to the intensive care unit. Some of the rewarding aspects of our job are, of course, helping people. It's a very rewarding, fulfilling feeling you get when you help someone who's sick and then you see them leave here and they're feeling better. It's respectable. People have a lot of respect for us. It's a nice lifestyle as far as salary. Everyone enjoys getting paid well, so it's a very nice salary job. Just to mention a few things. Education requirements for physician assistants specifically are generally bachelor or master's programs. I got into this 25 years ago, so for me, it wasn't quite as involved. There were some associate degree programs because the PA profession was relatively new, and there weren't very many PA programs at the time. So I was fortunate enough to go through a 2-year program. However, the accreditations and the requirements have now increased to bring the standard up a little bit from when I first started. As it is an evolving field, and the tasks that we perform now are getting more and more as far as helping the surgeons and physicians get things done in the hospital. Our responsibilities have grown tremendously, And I don't think the hospital could function very well without the physician assistants. We generally are the working interface for the surgeons. They use us in every aspect of the daily job requirements. Classes or activities that may help in the medical field. Biology is, of course, understanding physiology of life and anatomy and physiology. Animals are very similar to human beings. They all have systems that work in similar fashion. So if you understand one species, you may understand another one equally as well. Those are all very helpful things. Advice to a freshman in college: pay attention to the basic courses, like anatomy and physiology. Get a good grasp of those, because without those, you can't really get a grasp of the rest of the classes. It'll be very difficult. So if you have a good foundation, that will definitely help you. Those are the real important classes. There's anatomy and physiology. Everything branches from that. As far as how medications work, what systems they affect, what side effects they have. Those all come from those basic classes. And then everything gets pieced together once you have that basic understanding. What is a common misconception of modern medicine or surgery? That it cures everything. There's a continuous process of wear down and wear and tear on the human body, and some things are not completely curable. They're kind of temporized. You can slow down the process dramatically, but in some cases, a lot of things are not necessarily cured, such as coronary artery disease. That's one misconception with bypass surgery, is that once you have bypass surgery, you're cured. It's a continuous process, and those factors can be modified, either slowed down or sped up. So medicine is still something that's kind of shrouded in mystery. Once people go into the operating room, people don't understand or want to know what goes on behind those doors. They just want to come out and be fixed. So I think public education is something that needs to continue, so that people have a more realistic expectation of medicine and its limitations.